Hi, I'm Anvitha. I use she, her pronouns, and thank you so much for taking the time to listen to my speech today. Today I'm running to be a representative for the Electives Curriculum Subcommittee and the Appropriate Treatment of Medicine Committee. One of the best things about our curriculum is about how responsive it is to the needs of its students, especially when making change and improving our current standards. While the general curriculum is so important to the education of every physician, sometimes we forget to foster our own personal interests. As part of the electives curriculum subcommittee, I'm really interested in bridging the gap between personal interests and current topics that are so necessary for the growth of the individual. Electives, both clinical and non clinical, give us new perspectives in the world, whether it's through a niche medical field, teaching, social activism, and research. In particular, I'm really interested in being part of the research curriculum. We can really understand the context of our care through research, especially as a public health experience. Research has been a big interest of mine, and I hope to be a part of the changes that allow for everyone who has an interest to take part in it. In addition, I believe I'll be a great candidate for the Appropriate Treatment in Medicine Committee. As medical students, we have a huge responsibility. We're going to be the future doctors, and that title comes with a lot of advocacy as professional members of the community and as advocates for our patients. Even though as doctors we put in a lot of time and effort into taking care of others and advocating for their interests, sometimes we can lose sight of taking care of ourselves. As part of the ATM committee, I want to be an advocate for you as medical students. I want to be able to place an emphasis on our own well-being and health and work to reduce the mistreatment of medical students in general. It's so easy to feel like we don't have power or control as a student, but taking care of our own well-being and interests is so important to our own learning and capacity as physicians. I hope to be someone you can come to if you ever feel mistreated and to always be someone that can listen and be on your side. Thank you so much for listening, and I hope you choose to vote for me.